Imagine a beautiful young horse, full of potential, but instead of thriving, well, it just seems to be fading.
Hmm.
Maybe it's lethargic, losing weight, and then you see this really striking thing. It develops a strangely swollen, almost pot-bellied look.
Yeah, that's a classic sign.
It's not just a sad sight, is it? It's a very specific, pretty challenging gut disease
Mm.
that hits foals.
Hmm.
And that's exactly what we're taking a deep dive into today.
Right.
We're talking about equine proliferative enteropathy, or EPE.
Yeah.
It's caused by this bacterium called Lawsonia Intracellularis. Sounds a bit technical.
It is, but our mission here is really to unpack the key insights from the sources you've got. We want to help you understand what makes this bacterium so, well, unique,
Okay.
and how it affects these young foals, and also the really intensive efforts, sometimes surprising ones, that go into diagnosing and treating it successfully.
Right.
We're basically distilling some complex veterinary info into hopefully clear, actionable knowledge for you.
Okay, so let's unpack this then. Lawsonia Intracellularis. You said it's unique. What exactly is it? What makes it different from your average bug?
Well, it's fascinating, really. It's what's called an obligate intracellular bacterium.
Obligate intracellular.
Exactly. And that term, obligate intracellular, it tells you pretty much everything. It means it must live and multiply inside the host's cells.
Oh,
It can't just, survive and grow freely out in the environment, or like on a culture plate in the lab like lots of other bacteria can.
so it's highly specialized.
Incredibly specialized. It specifically targets and thrives inside the intestinal cells, the enterocytes, particularly down in the small intestine, the ileum and jejunum mostly.
Okay, obligate intracellular. That definitely sounds specialized. So it has to live inside the cells. What does that actually do to the foal? How does it cause disease?
Well, that's the absolute core of the problem. By living inside these enterocytes, Lawsonia somehow tricks them, essentially, into growing and multiplying way too much. We call that proliferation.
Proliferation. Abnormal growth.
Exactly. And the result is this really marked thickening of the intestinal lining, the mucosa, especially, like I said, in the small intestine.
Wow.
And this thickened, abnormal gut wall becomes, well, profoundly dysfunctional. It just can't do its job properly. It loses its ability to absorb vital nutrients, leading to severe malabsorption.
Okay, so it can't take nutrients in.
Right. And at the same time, it starts to leak protein out into the gut, so you get significant protein loss.
Ah, I see.
So the key thing to grasp here is that EPE isn't just about an infection. It's about how this bug forces the gut to grow abnormally, and that leads directly to this life-threatening protein loss. It's a fundamental disruption.
Not just an infection, a disruption. Got it.
And that breakdown is the root cause of all those clinical signs you mentioned earlier.
Given how disruptive that is, who gets hit hardest by this? Is it any horse, or is there a particular group that's more vulnerable?
It's primarily foals, and there's a pretty specific age window. They usually become susceptible somewhere between, say, 2 and 8 months old.
2 to 8 months.
Yeah, but the peak incidence is really right around 4 to 7 months.
Okay. Why then specifically?
Well, that timing is really significant because it often lines up with two critical things happening in a foal's life. One is the stress of weaning.
Weaning stress. Always tough.
Exactly. And two, it's also the time when the maternal antibodies they got from their dams colostrum, the ones providing early protection, are starting to wear off, to wane.
So a double whammy, basically.
Hmm.
Less protection, more stress.
Precisely. That combination just seems to make them particularly vulnerable right in that window.
That makes a lot of sense. Now, thinking about how it gets around,
Mm-hmm.
if Lawsonia has to live inside cells, how does it actually spread from one animal to another?
Well, the suspected route is fecal-oral,
Okay.
meaning foals probably ingest the bacteria from an environment that's been contaminated with feces from an infected animal.
Right.
But what's really interesting and adds a layer of complexity is that Lawsonia intracellularis isn't just a horse problem, not at all. It infects a really wide range of other animals, both domestic and wild. We're talking pigs, that's a big one, but also hamsters, rabbits, even deer, ferrets.
Wow, quite a list. So there could be wildlife reservoirs contributing.
Exactly. It suggests there might be significant wildlife reservoirs out there, potentially seeding infections on farms.
Does that make it harder to track outbreaks on, say, a horse farm? Or is it mostly horse-to-horse spread once it's there?
It definitely complicates prevention, you know. You have to think about potential outside sources. But once an infection is established on a farm, infected foals do shed the bacteria in their feces.
Okay, so they can spread it to others.
Yes, they can. The good news, though, is that this shedding usually drops off pretty quickly, often stops within just a few days, once they start on the right antimicrobial treatment.
Okay, that's good to know. Now, recognizing EPE, you mentioned it can be tricky. The signs are varied, nonspecific, and often creep up slowly, right? That insidious onset.
Exactly. It can make early diagnosis a real challenge for everyone involved. But some of the common things you'll see are chronic weight loss or just poor body condition. The foals just look unthrifty, stunted.
Failing to thrive.
Right. You might also see lethargy, depression, maybe an intermittent or low-grade fever. But those signs could point to a lot of things.
True. So among all those possibilities, what's the sign that really makes a vet think, could this be EPE?
Often the most characteristic and sometimes the most striking sign is peripheral edema. That's cool, non-painful swelling.
Edema, like the pot belly.
Exactly like the potbelly. But why does it happen? It's because of severe hypoproteinemia, really low protein in the blood specifically, very low hypoalbuminemia. Albumin is the main protein responsible for holding fluid in the blood vessels.
Ah, so when the albumin drops because it's being lost through that damaged gut.
Precisely. The fluid leaks out into the surrounding tissues. It paints quite a picture, doesn't it?
It really does.
And this edema, like you said, is most common in the ventral abdomen, giving that pot-bellied look. But you can also see it in their lower legs, the distal limbs, sometimes under the jaw and the throat latch area, or the sheath in colts.
That pot-bellied image is certainly memorable. So if swelling is key, but maybe diarrhea isn't always present, what's a common misconception?
That's a great question. I think the idea that diarrhea has to be there or that it's the main problem is a big one. It's actually quite variable. Some foals have it, some don't, some have it mildly.
Okay.
The primary issue really stems from that malabsorption in the small intestine, not necessarily massive fluid secretion happening further down. So you can definitely have a severely affected foal without raging diarrhea.
Good point. Any other subtle signs to watch for?
Yeah, sometimes you might see mild colic signs, maybe a rough, poor-looking hair coat, reduced appetite is common. And it's also pretty common for these foals to have other things going on at the same time, like respiratory infections or gastric ulcers.
Right, which would definitely muddy the waters diagnostically.
Absolutely. It complicates the picture.
So with all these varied signs, some subtle, some dramatic, like the edema, how do vets actually pin this down? How do they confirm it's EPE? Must be like detective work.
It really is. It always starts with clinical suspicion. You see a full right age group, losing weight, got that edema, looks depressed. EPE definitely jumps onto the list of possibilities.
Okay, so suspicion first, then what?
Then blood work becomes crucial. And the big flag, the most consistent and characteristic finding, is severely low total protein and albumin levels, often profoundly low.
Direct result of that protein loss we talked about.
Exactly, that protein-losing enteropathy. You might also see other things like elevated white blood cell counts, leukocytosis, suggesting infection or inflammation, and maybe high fibrinogen, another inflammatory marker.
And beyond blood tests, imaging.
Yes, abdominal ultrasonography is a really key tool here. The vet can actually look at the intestines, and often they'll find that characteristic thickening of the small intestinal wall, sometimes dramatically thick, maybe greater than 9 millimeters, which is way more than normal.
Wow, you can actually see the physical change caused by the proliferation.
You can. It's a strong indicator.
So once that suspicion is really high, based on signs, blood work, ultrasound, what are the specific tests to actually nail the diagnosis and say, yes, it's Lawsonia?
Right. Then you need tests that either detect the bacterium itself or the foal's immune response to it. Fecal PCR is very common.
PCR, looking for the DNA.
Exactly. It detects the bacterial DNA in the feces, so it's good for confirming an active infection. But, you know, there are nuances, like if the foal has already started antibiotics, you might get a false negative because the shedding has stopped.
Ah, okay. Good to know. What else?
Then there's serology. This looks for antibodies against Lawsonia in the blood.
So that shows exposure.
It shows exposure, yes. It doesn't necessarily mean active disease right now, but if you take paired samples, say a few weeks apart, and you see a significant rise in the antibody level, that's strong evidence of a recent active infection.
Got it. Paired samples are key for serology.
Often, yes. And it's worth mentioning the absolute definitive diagnosis is actually identifying the bacteria within the intestinal cells on histopathology, looking at tissue samples under a microscope. But obviously, that's usually only done post-mortem.
Right, not practical for treating a sick foal.
Not at all. And another critical point, you can't grow Lawsonia intracellularis using standard bacterial culture methods in the lab because it has to be inside cells.
Back to that obligate intracellular thing.
Exactly, which is why combining the clinical picture with these specific molecular tests like PCR and serology is so important for making the diagnosis in a living animal.
Okay, this definitely sounds like a tough condition. So let's talk treatment. I gather that prompt and aggressive treatment is really key for a good outcome.
Absolutely crucial. Survival rates are much, much better with early and intensive intervention.
And it sounds like it's a two-pronged attack.
Yeah.
You need the right antibiotics, but also a huge amount of supportive care.
That's exactly right. For the antimicrobial therapy, remember, Lawsonia lives inside the cells. So the antibiotics you choose have got to be able to get in there.
Right, penetrate the host cells.
Yes. So common choices are macrolides, like azithromycin or clarithromycin. These are often combined with another drug called rifampin.
Why the combination?
Well, the macrolides are good at getting into cells, and rifampin seems to boost that effect. Plus, it helps prevent the bacteria from developing resistance to the macrolide. It's a pretty powerful combo.
Okay. But I think you mentioned a caution with macrolides.
Yes, a very important one. Macrolides are generally not recommended for use in adult horses, and you have to be really judicious even in older foals. There's a significant risk they can cause a severe, sometimes fatal colitis inflammation of the colon in horses older than young foals.
Wow. Okay. So careful patient selection is vital there. What are other antibiotic options?
Tetracyclines, like doxycycline or oxytetracycline, can also be effective as they get into cells reasonably well. And chloramphenicol is another option that works.
Chloramphenicol. Isn't that restricted sometimes?
It is. It's not allowed in animals intended for food, and it carries a small risk of causing potentially fatal bone marrow suppression in humans, so people handling it need to be extremely careful, wear gloves, avoid contact.
Right. Lots to consider with the antibiotics.
Yeah.
And you said that's only half the battle. Let's talk about the other equally critical part, the supportive care. This must be where it gets really intensive.
Oh, absolutely. Supportive care is non-negotiable, especially for those foals with severe hypoproteinemia. It's often life-saving.
So what does that involve?
Well, first, IV fluids. Lots of them, usually to correct dehydration and electrolyte imbalances. Then, critically, oncotic support. Because their blood protein, especially albumin, is so low, they need something to help hold fluid in their blood vessels.
That's where the plasma comes in.
Exactly. Plasma transfusions are often necessary, sometimes multiple transfusions, to boost those albumin levels. It's a direct way to replace the protein they're losing.
That sounds intensive.
Yeah.
And probably expensive.
It can be, yes. Sometimes synthetic colloids, which are special IV fluids, might be used as a temporary measure to help with oncotic pressure, but plasma is often preferred for replacing the lost albumin and other beneficial factors.
Okay. Fluids, plasma, what else?
Nutritional support is vital. If the foal isn't eating, they might need parenteral nutrition, getting nutrients intravenously. If they are eating, you want easily digestible, high-quality feeds. Anti-ulcer medications are almost always given because stress and illness make these foals prone to gastric ulcers.
Makes sense.
And maybe NSAIDs, non-steroidal anti-inflammatories for pain or inflammation, but you have to use those cautiously too, watching out for potential kidney or gut side effects, especially in a sick, dehydrated foal.
Right.
And finally, don't forget biosecurity. Isolating the affected foal is really important to stop the bacteria from spreading to other susceptible foals on the property.
Wow, that is a lot of intervention. Fluids, plasma, special feeding, gut protection, antibiotics. It really highlights the severity. Are there significant risks with all that intensive therapy itself?
That's a fair question. Vets are always walking that line, balancing the need for aggressive intervention against potential risks. We talked about the macrolide risk. With IV fluids, you have to monitor carefully to avoid fluid overload. With plasma, there's a small risk of transfusion reactions.
Okay.
But the supportive care is designed precisely to mitigate many of the risks of the disease itself, like managing dehydration, replacing protein. And honestly, the long-term outlook with this intensive care is generally so positive that it makes the effort very worthwhile.
Okay, speaking of the outlook, after all that, the plasma, the intensive care, what is the prognosis for these foals? Do they bounce back?
Generally, yes, with that prompt and aggressive treatment we've been talking about. The prognosis for survival is actually good to excellent. Studies report survival rates up in the mid 90% range.
That's fantastic, considering how sick they get.
It really is. Now, while the clinical signs of the lethargy, the edema often start improving relatively quickly once treatment begins, it's important for owners to know that the hypoalbuminemia, the low protein, can take several weeks to fully resolve.
Because the gut lining needs time to heal properly.
Exactly. That mucosal healing takes time. And in terms of long-term effects, foals that have had EPD might experience some slowed growth initially. They might be a bit smaller than their peers for a while, which could potentially impact sale value early on.
But do they catch up?
The good news is most eventually do catch up in size and return to normal health and, importantly, normal athletic function down the road.
That's great to hear. And just to recap on the shedding, it stops pretty quickly with antibiotics.
Typically, yes, within days. But as a precaution, it's wise to maintain those biosecurity measures like isolation and thorough cleaning for at least 7 days after treatment ends, just to be safe.
Okay, so given how serious this can be, let's shift to prevention. What can farms or owners do to try and stop EPE from happening in the first place?
Well, some key strategies revolve around the basics, but they're important. Minimizing stress, especially around that vulnerable weaning period, is huge.
Right, stress management.
Ensuring good parasite control is also important, as internal parasites can further compromise gut health. And then general biosecurity practices things like prompt removal of manure from pastures and stalls, trying to limit contact between foals and other animals that might carry Lawsonia, like pigs or potentially wildlife if possible.
Makes sense. Anything more specific?
Yes, actually. And this is where it gets quite interesting. There's a significant prevention tool that's being used more and more, a live attenuated vaccine.
A vaccine for Lawsonia in horses.
Well, here's the twist. This vaccine was actually originally developed and licensed for pigs to prevent a similar disease they get from Lawsonia.
For pigs. But it works in foals.
It has shown efficacy, yes, in either preventing EPE in foals or at least reducing the severity of the disease if they do get infected. It's often used off-label, meaning not specifically licensed for horses, and it's typically administered intrarectally.
Intrarectal, wow.
Yes. It's commonly used on farms located in areas where ETE is known to be endemic as a preventative measure for young foals. But because it's off-label use, it's definitely something owners should discuss in detail with their veterinarian to see if it's appropriate for their specific situation.
That's fascinating. A pig vaccine used indirectly in foals. Veterinary medicine is always innovating.
Absolutely. It shows how vets adapt tools to meet challenges.
So, managing Lawsonia intracellularis in foals. It really is a clear example of the unique challenges veterinary medicine faces, isn't it? And the sophisticated, really multifaceted approach needed. That early recognition and the comprehensive aggressive care seem absolutely paramount.
They really are. And it kind of leads to a broader thought, doesn't it? When you consider all that goes into it, the intensive care, the plasma transfusions, which aren't cheap, the specialized antibiotics, the sheer financial and, frankly, emotional commitment needed to save one of these foals. What does that tell us?
What do you think it tells us?
Well, perhaps it tells us something about the evolving landscape of veterinary medicine and maybe about the extraordinary value we increasingly place on individual animal lives, their health, and their well-being in this day and age. It's quite a shift, maybe, from how things might have been viewed decades ago.
That's a really interesting point. The sheer effort involved speaks volumes about that value. Something for all of us to ponder, definitely, as we think about the depth of care behind these sometimes surprising stories in animal health.